This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. There are variations on this. As I mentioned at the beginning, there's something called a long cycle. Now, in that cycle, we start a nasal spray or injections 7 or 8 days before an expected period, which would then follow on as the egg collection cycle. The difference there is so that we switch off your pituitary gland and we totally take control of your ovaries. This used to be the standard technique before we had antagonist drugs, but it is a longer cycle, and most patients, when asked, those that have experienced both, will always choose to go down the short protocol route because it's all over much more quickly. In terms of success, it's identical. It doesn't matter which way you go. There is one or two downsides of the long down regulation. First, as I said, is the time frame. But the second is there is a condition called ovarian hyperstimulation. So if your ovaries really take off, you're more likely to get what's called the ovarian hyperstimulation syndrome in a long down regulation cycle. So it's a reason why, particularly in young women or women with polycystic ovaries, we always move away from the long protocol to an antagonist protocol. It's much safer. That's the protocols. That's the two regimes that are most commonly used. Another regime that is coming into vogue to reduce the number of injections that you have to take is that we use a progesterone tablet once a day from the beginning of the cycle to suppress the pituitary gland and stop it from causing you to release eggs early. And then you just take the FSH preparation on a daily basis through to the egg collection. The advantages of this is obviously less injections, and what it also means is we've got a little bit more control about when we're going to do the procedure. The downside is that in that cycle, we aren't able to transfer an embryo because the lining of the womb has been affected by the progesterone and it won't be suitable for implantation. So we definitely do not do a transfer. But there are many women who set out on cycles where we're never going to do a transfer, a fresh transfer. These are women who are having genetic testing on their embryos or where they're freezing just their eggs for future use. But we're certainly moving to that. From a patient's perspective, it's much nicer taking a tablet at night rather than another injection. So that progesterone approach is becoming much more commonly used. And again, it doesn't change the outcomes compared with any of the other two regimes, except that the embryo is going to be frozen and it will put back in a subsequent cycle. But pregnancy rates in that subsequent cycle are no different. So then that's talking about the different stimulation regimes.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.